Welcome to Repros Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, Repros. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I'm really excited for this week's episode. We are talking about some good news that happened last week, and not just one piece of good news, two pieces of good news. And, it was so energizing to have victories. Like, so often we are talking about the next terrible thing or so many other things that have happened that we don't get a chance to take a second and celebrate the good news. So we're taking a second in this week's episode to celebrate the good news. So I'm going to bring that vibe to my intro as well. Instead of focusing on all of the other things that are happening, let's talk good news. So first, my piece of good news is I have gotten my vaccine. I thought I was going to be waiting a really long time to be able to get an appointment. Things were a little slow in DC, but I had a friend who called me out of the blue and she had found an appointment for me. And she's like, Jenny, I will drive you there. We will go. So not only did I go get my vaccine, I got to see a friend that I haven't seen in over a year. And y'all, it was, that we're just like living in crisis mode for so much that you don't get a chance to think about or process or, any of those things. And so I thought I was doing fine. Like, no big deal. Like, if I have to keep waiting, no big deal. I'm fine. I'm staying home. Like, I'm not worried about not getting the vaccine right away. Like, it's fine. But man, when she called and told me she got an appointment and had an appointment for me and I was going to get to see her, I cried. I didn't realize the weight I was carrying of not being able to see friends and not being able to go out and do things. So it was really exciting. I got Johnson & Johnson, so I got one and done. So, of all the things I thought were going to happen that Friday when I woke up, getting vaccinated and being fully vaccinated were just absolutely not on my radar. So that was really exciting and nice. And it's nice to have it done. I was really lucky and had no really major side effects. My arm really hurt the next day, but I knew to expect that. And I was a little tired. But other than that, it was not bad. I have no complaints. And it was actually really nice to be one and done and not have to worry about trying to find another appointment. So that was really exciting. And I'm really close to being able to see other friends soon because I'm almost through my 2-week window. So that is super exciting. So I think Friday it will be 2 weeks. So that will be very nice to be able to see some people. Also really exciting. Y'all got to meet Rachel on our Ask Me Anything episode. So she had moved to Atlanta for grad school a little over 2 years ago now. It feels much longer. But anyway, she's moving back to DC this week, y'all. I am so excited. I've been able to see her at a couple events, but obviously in the last year, I haven't been able to see her at all. And I'm just so excited to be able to see her and some other coworkers, hopefully soonish. We are all vaccinated, and as soon as I am through my 2 weeks, she will be here, and I will be able to see some people and see friends, and it's super exciting. And that's the kind of energy I want to take forward, right? There are just these little things that are just so exciting, and it will be nice to see people and be able to get together and maybe have a picnic lunch or something. It sounds delightful, and it is getting me through all the things right now. So that's super exciting. And I think I said exciting a lot. Can you tell I'm excited? It's been a happy little week, minus all the other things happening, just personally. And so let's just take that energy going forward. I'm excited to talk about the good news and have two wonderful guests on this week to talk about a couple of good administration actions that happened last week. So I have Nina Serriane and Dee Srivastava at Planned Parenthood with me to talk about the FDA requirements around medication abortion that changed last week for during the pandemic and the proposed changes to Title X. So with that, let's go to the interview with Nina and Dee. Hi, Dee, Nina, thank you so much for being here today. I'm so excited to talk to you.
Thank you for having us.
Yeah, thank you. This is wonderful.
Okay, so let's see. Who wants to go first? Nina, do you want to take a second and introduce yourself?
Sure. So my name is Nina Serriane. My pronouns are she, her. I'm the Legislative Affairs Manager at Planned Parenthood Federation of America, and I'm thrilled to be here with you all today.
Awesome. Dee?
My name is Dee Srivastava. I use she, her, hers pronouns, and I'm a policy analyst at Planned Parenthood Federation of America.
So I'm so excited to have both of you here today, not just to see you, which is always amazing, but because we're actually talking about good news. And it's not that often that we get to talk about good news in repro, so I'm pretty stoked. So let's start with a couple of things that happened last week. There was some changes around medication abortion. Do you want to talk about what happened?
Yeah, so this was, like you said, I feel like celebrating our wins is not something we get to do very often. And this was a really wonderful first step taken by the FDA following the science. This was also a really important step forward for access to abortion care and health equity. So what is this important first step? Let me say what that is. Last Monday, the FDA suspended medically unnecessary barrier to medication abortion for the duration of the COVID-19 pandemic. So for those who aren't familiar, there's the risk evaluation and mitigation strategy restrictions, the REMS restrictions on mifepristone, which is one of two medications taken in a medication abortion. So right now, for the last 20 years, there's been barriers that aren't supported by science that include a mandate that patients pick up mifepristone, or Miffy, as you'll probably hear me call it, the nickname for it. The mandate is that patients pick that medication up at the doctor's office, hospital, or health center, rather than in a pharmacy or by mail, as the FDA allows for equally safe medications. So this is, like I said, this is a wonderful first step. It recognizes that this is an unnecessary in-person risk to COVID. You know, people, whether it's with childcare or transportation or whatever it is that they're trying to get to the health center for, it's all these risks to COVID that are just not needed. So I'll pause there in case you have other questions.
Yeah, I mean, I think you started to touch on this, but like, what is this going to mean for patients and how they access care?
Yeah, so mifepristone has been used for over 20 years. It's safe, effective, has a safety record of over 99%. And this restriction, it's the only restriction on this type of medication, one that the FDA requires to be dispensed in person, but permits patients to self-administer at home. So this means that people don't need to expose themselves to COVID to get the care that they need. We know that abortion's time sensitive, and we know that people need to be able to get the care they need when they need it. So it's really about keeping people safe. These restrictions are medically unnecessary to begin with, but they're also a public safety issue when we're in the middle of a global pandemic.
Yeah, no, it's great to get rid of this unnecessary barrier. I think it's going to make it so much easier for patients to access care they need without having to jump through this extra hoop. So that's it, right? We're done. We don't have to worry about it anymore. It's gone forever.
If only. So, like I said, this is an important first step, both because it's part of, it's just a small part of the REMS restriction, or small part. It's big for people that need to access care, but it's only part of the REMS restriction, and it's only for the duration of the pandemic. So really what's needed next is that we're calling on the Biden administration and the FDA to take that step to continue following the science and do a review of the full REMS restrictions, not just for a pandemic. We know that these restrictions and barriers to accessing abortion care existed long before the pandemic started and that they're going to continue after. So it's really critical that the Biden administration takes a look at the science and sees that this is medically unnecessary.
Yeah.
Also, so with this call to action, this is something that we've been asking the FDA to take action on, but also we were joined with 55 reproductive health rights and justice partners last month in calling on the administration to make these changes. And we were joined by 200,000 supporters who also joined the call asking the administration to take action. So this is something that people know that, is a decades old restriction and it's time for it to go.
Yeah, I just can't imagine how much easier it will be for people to access care and be able to get abortion care in the way they want if we can get rid of these restrictions, not just now, but just completely.
Absolutely.
So this isn't the only victory we had, right? There was another, at least start of a victory that happened next week, and that has to do with Title X. So what happened last week? What did the administration do?
Yeah, so the Biden-Harris administration last week took yet another step, very exciting, to restore access to essential sexual and reproductive health care by taking a step to end the Title X gag rule. So I'm actually going to start by explaining a little bit more about what the gag rule is and why getting rid of it is so critically important. So in 2019, the Trump-Pence administration implemented a domestic gag rule on the Title X family planning program, which prohibited Title X grants from going to providers where clinicians told their patients how they could safely and legally access abortion, even if they asked. So it interferes with the communication regarding a full range of treatment and options between a patient and a provider, a very important relationship, the integrity of which is central to how healthy people can be. It also restricted the ability of providers to tell the truth, to disclose a full range of information to their patients. And thus, it is extremely unethical and it violates the ethical standards of, I would say, most healthcare professionals. And because of the type of restriction that was sort of imposed, it forced a lot of providers to leave the program. In fact, it cut the Title X network capacity nearly in half, and it also had the effect of making it so that 6 states no longer have a single Title X provider at all. Before the gag rule was implemented by the Trump administration, Planned Parenthood health centers served approximately 40% of the program's 4 million patients. And after that gag rule began, patients receiving Title X services were, maybe forced to find new providers or stop receiving critical care entirely. So now we pivot to what happened last week, where following a months-long review process, the Biden-Harris administration found that the gag rule undermines the public health of the populations that the Title X program is meant to serve. And so on April 14th, the U.S. Department of Health and Human Services issued a notice of proposed rulemaking entitled Ensuring Access to Equitable, Affordable, Client-Centered, Quality Family Planning Services to begin the process of formally ending this harmful Title X gag rule. The rule also includes some very important updates to Title X program requirements to, meet the needs of the 21st century, meet a better and more understanding and wholesome definition of health equity and inclusivity, and how access to sexual and reproductive health care is central to people's lives, to their futures, to their freedom, and to the nation's health. This new rule from the Biden-Harris administration unequivocally states and quantifies the harms that the gag rule has imposed on patients over the past 2 years, the disparate impact of these harms to populations who've always faced systemic barriers. It's what we've long known, that rules like this gag rule are entirely politically motivated and most undercut access for people who live in rural areas, medically underserved areas, people without insurance, people with low incomes. And as we've seen time and time again, these disproportionately affect Black, Latino, APIA, Indigenous communities.
So this is a really important step to bringing back Title X and making sure that clients are able to access care. So it is just a step in the process. So what would it mean if the gag rule were repealed? Like, how would this impact patients?
Absolutely. So, like I said just earlier, Title X disproportionately serves patients with low incomes, patients in rural areas, patients of color, who have been facing centuries of disenfranchisement, systemic racism, and health inequities. People from these communities have always faced daunting barriers to getting the care that they need, and this gag rule is no exception. We also have to remember that we're in the middle of a pandemic, and so none of these things are happening in a vacuum, and the COVID-19 pandemic has further exacerbated the harms that people are facing and the sort of barriers to access for healthcare where people need accessible and affordable healthcare services. So this gag rule essentially cut the Title X provider network's capacity in half. It made it so that 6 states don't have a provider to deliver Title X services at all. And on top of that, we've also seen that it's not just about Planned Parenthood health centers. It slashed the ability for providers in several states where they were forced out of the program and not able to see patients. And so the impact is huge, and it has been further exacerbated by the pandemic. So in spring 2020, 33% of women faced delays or were unable to access contraceptive or other care, which disproportionately affected women of color and women of low incomes, who were more likely than white women and women with higher incomes to report these types of delays. We've also seen, the economic impacts of the pandemic affecting access to care. We know that people of color make up the majority of low-wage earners who were economically impacted by the pandemic, and how women of color are more likely to hold jobs deemed essential than any other demographic. And so they have accounted for most of the job losses due to COVID-19. And the last thing that people need to deal with is a further loss of access to care when people need it, because we know that the Title X program is there also for populations who are uninsured, and uninsurance disproportionately affects women of color, women with low incomes, and a lot of people who still don't have a path to coverage at all. Before the pandemic, STI rates were already at a record high for the 5th consecutive year, which has a bearing on future health outcomes for all sorts of communities. And the pandemic has continued to also limit the availability of testing and treatment services, where even more STIs are going undetected and untreated. But a good thing about this new NPRM, or Notice of Proposed Rulemaking, is the fact that the modifications it makes to strengthen the Title X program center health equity for what I believe is the very first time. And I think that, it will be really hard to repair the harms that have occurred over the past 2 years without also making sure that investments in care are meaningful and congruent with the need that continues to grow. But this effort to make the program more inclusive and expand its sort of ability to take care of people to meet the need that is happening, it needs to include both, more inclusive definitions and standards of care, but also the ability to invest in the program, given it's been underfunded for so many years. Restrictions like the gag rule, they are entirely politically motivated, and they are there to undercut access to healthcare. And because of what we've seen, which is that the majority of providers who are forced to leave the program due to gag were providers who specialize in sexual and reproductive health care, that impact is very disproportionate and very great. A lot of people, might be losing access to the contraceptive method of their choice or to the provider that they trust or to, it's just another thing to figure out in the midst of a lot of other things that are piling up for people right now. The health and economic devastation is so palpable. And when politically motivated attacks that frankly make it so that federal programs aren't able to serve their function, which is deliver healthcare to the communities that need it, happen, then what we see is that the people who are most harmed are people of color, people with low incomes, people who are queer, people with disabilities, people who are already facing disproportionate barriers to care and frankly don't need any more, especially during a global health crisis. So gag rule has had a very significant impact on what healthcare means, what healthcare access means. And all of this is happening while the need to be able to plan your future and be healthy is more important than ever.
I think one of the things listening to the two of you talk about both of these changes is how both of them are going to impact how rural communities, how communities of color are accessing care. And it's such a great expansion for both of them. And that's a really important first step for the administration to be taking around sexual and reproductive health care.
Absolutely. Mm-hmm. And I'll just add, because I don't think I said this at the beginning, what Title 10 really is and what it means to people. So Title 10 is the federal program that provides grants to healthcare providers so that people who are uninsured, underinsured, have low incomes can access free and low-cost sexual and reproductive healthcare services, which includes birth control, contraceptive education and counseling, STI testing and treatment, preventive screenings for breast and cervical cancer, and other kind of preconception care and preventive reproductive health care. So these services are incredibly important also because they have additional protections in place, such as patient confidentiality. So services are put in reach in a way that they might not be through other efforts to expand healthcare. And these things are very tangible and tangibly affect what the face of healthcare and public health looks like in our country. The ability to access a preventive preconception screening or the ability to catch a precancer is the thing that is going to save a life. And it's going to make it so that people who are already facing systemic racism and health inequities can prevent these things from happening. And the providers who are meant to serve them can keep them healthy. It also means, if you're a survivor, maybe interpersonal or domestic violence, that if you are accessing an STI test that you don't need someone finding out about, that you can do that. And you can do that, with a sliding scale, provided that your provider can provide that for you. It also means, you can access things like contraceptive care or other care that, might not be something that you want, people in your family to know about, or something, else entirely where you might need privacy. You're able to access those services in a way that's affordable. So losing providers who have the ability to sustain that type of care is losing a very big chunk of our healthcare system in a way that markedly and tangibly affects a lot of the health outcomes that you hear so much about, things like maternal health outcomes, things like outcomes from, infertility or cancer, or, just the ability to determine with autonomy what it is that you want for your future, the ability to plan your family, the right to parent, to not parent, and to parent the children that you have in the way that you choose. Obviously, federal funding is just one piece of the puzzle, and that sort of framework that we are working out of, the reproductive justice framework that so many people, so many of our partners, and so many of the ways that Planned Parenthood has been held accountable and continues to be accountable, so much of that is also linked to this. So the rescission of this gag rule is just one priority that has been set by a coalition of more than 100 bold progressive organizations convened by Planned Parenthood, Federation of America, and in our own voice, National Black Women's Reproductive Justice Agenda. These groups developed a document entitled First Priorities for the Blueprint for Sexual and Reproductive Health, Rights, and Justice, which is a detailed list of executive and agency actions, including this one, that we hope that this administration swiftly addresses. And it can't be emphasized enough that in order for any of our goals around healthcare equity and access, as well as the achievement of any of these listed actions, includes ending the Title X gag rule so that patients can get the care that they need during the pandemic and beyond.
Yeah.
Jenny, I think that's something really important that you said about access in rural areas, especially with medication abortion. Planned Parenthood health centers know firsthand just how safe and effective online abortion services can be, especially for patients who are in need of timely care, and especially, like you said, for patients who are living in rural or remote, or as Dee was saying, medically underserved areas. So we know that our health centers are already helping patients access safe and legal abortion care. And because of this announcement from the FDA on mifepristone, some Planned Parenthood health centers will be able to start providing direct-to-patient medication abortion in additional states, obviously in compliance with the laws and regulations of those states. But this really is a huge win for all patients accessing abortion care, but specifically those in rural and underserved communities, like you were both saying.
Yeah, that's one that hits close to home. I grew up in rural Wisconsin, and I think the closest place that I could have gone to access care was in Madison. So it was an hour drive away, but like it wasn't something that was going to be like easy to get to for me as a young person versus if it had been somewhere closer. So that is one that hits particularly close to home. And I know an hour to access care is much lower than it is in some places in the country to get to reach the closest clinic. So being able to get telehealth or being able to access abortion services online, being able to get medication abortion shipped to you would really be a game changer for those people. So the Title X is a proposed rule. So what comes next?
Absolutely. So this is a proposed rule, which means that now there is a notice and comment process where the public can actually go in and tell the administration just how important it is to protect this program and right the wrongs of not just the last 2 years where providers were forced out of the program and unable to be able to participate in this critically important, frankly, lifeline for a lot of people, where it's, their one point of access for care, but also the right the wrongs of what has been happening in our health system where there hasn't been a focus on inclusivity or health equity. This rule includes a lot of new definitions that, make it so that providers need to prioritize the fact that a lot of communities have different needs. A lot of them have already been doing this, and a lot of them have not been, fully recognized for just who they serve and what healthcare means to those populations. So hopefully, the ability to emphasize the fact that it's so important to save this program and to allow providers to participate again so that they can start serving patients again, but also to take the framing of this rule, this framing of health equity and inclusivity and access, and ensure that it is done with integrity and that a lot of the people who have been left out of the program in the past can, access care in new and improved ways, I would hope. And so Planned Parenthood, of course, we are going to be commenting on this rule and working with partners, but we can't do this without hearing from, and the administration hearing from, who this truly matters to, whether that's patients or providers or advocates, supporters, or more. And so if you would like to submit a comment, or if anybody listening would like to submit a comment, the comment deadline is May 17th, which will mark this sort of period where the administration will begin reviewing who they hear from, reviewing the things that they've heard. So if you want to submit a comment to the administration on the harms of the gag rule and on what access to this care means to you, you can text Title 10, the Roman numeral, so Title X, with or without a space, to 22422, and you'll be connected with a comment collection form. You can go ahead and fill it out, and then we'll take care of the rest, and we'll submit it to regulations.gov for you. And so that way, you can make your voice heard in a very easy way. Hopefully, we can make it so that, we have a strong showing so that the administration knows exactly how important this is. This next month is so critically important to building that case and to ensuring that they are hearing from who they need to hear from. Many of the people who they need to hear from are all of you.
So that definitely is amazing to have a way for people to comment and make it easy.
Mm-hmm.
So that definitely starts my next question, which is what can the audience do around these issues? So Dee, definitely shout out the text information again. And Nina, is there anything that the audience can do around medication abortion?
Really, at this point, it's up to the FDA. The FDA needs to follow the science and take a look at these decades-old restrictions that, as I said before, are completely medically unnecessary. They're not rooted in what people need. So it's up to the FDA now to take that next step and expand these lifting of restrictions far beyond the pandemic. Like I said, these restrictions existed, or the barriers to care existed before the pandemic. They'll continue to exist after. So it's up to the FDA to review the materials and lift those barriers for folks.
Yeah. And on Title 10, it will take a lot to undo the harm for the patients who have been denied critical care these past 2 years. We need to move as swiftly as possible to finalize this rule and make the case for this rule as clear as possible to prevent more people from being hurt and further attacks to undercut the Title 10 program. So for the next month or so, until May 17th, the best thing that we can do is continue to collect comments and ensure that the administration is hearing from the people who this matters to. So folks who are interested in submitting a comment letter should text Title 10, that's the Roman numeral, so Title X, to 22422, and you'll be connected with a comment collection form where you can submit your comment and we'll take care of the rest.
Awesome. And we'll make sure to include all that information in our show notes so it's easy to access if y'all did get a chance to write down the number. Nina, Dee, thank you so much for being here today. It was wonderful to get to talk about good news with you.
It was wonderful to talk about good news for a change. Really is such a hopeful time. And I'm so grateful I got to talk with you both. And I'm really excited for what's to come.
Thank you so much for having us on. Like Dee said, it's always a pleasure to chat good news. So thank you so much.
Okay, y'all, I hope you enjoyed my conversation with Dee and Nina. I had a great time talking to them. It was nice to take a minute to celebrate some victories. There's obviously more work to be done. Both of these were just first steps, but with all of the heavy and the bad, it's really important to go ahead and take a minute and celebrate the victories. So I'm glad we were able to do that this week, to take a minute and celebrate these two victories. And with that, I will see you all in 2 weeks. If you want to reach out to us or have ideas for episodes, you can always email me at jenny@reprosfightback.com, or you can reach out to us on social media. We're at reprosfightback on Facebook and Twitter, and reprosfb on Instagram. Otherwise, I will see y'all in 2 weeks. For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback and on Instagram at reprosfb. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.